So my name is Chelsea Ng. I graduated from UW in 2023. I'm originally from Malaysia. I grew up in Kuala Lumpur, was born and raised there, came here for college in 2019, and I will be attending medical school in the fall at UW Spokane. I was very interested to see how this was done for every single patient, and I was really surprised and impressed by how it's done here, where the interpreter really comes in and they know so much about the patient's kind of culture and they're part of the community, or even through the phone. I was just really impressed with Duncan's kind of patience and just his willingness to sit down and kind of work through that barrier and really just showing that empathy and compassion, even though it might be in a different language. And I think those kind of are universal values that are really shown across when I was shadowing here. So I was invited to help work on the cultural profiles for latent TB, and I got assigned to work with the Congolese population. I didn't really know much about the Congolese population before this. I can't say that I know anyone from the Congo or the DRC. I thought it was really cool that we got to travel down to Tukwila, to the Methodist church where a lot of the asylum seekers from the Congo were staying. We got to be immersed in the community. They were having a health fair at that time, so I really got to see the different needs that were being met there, and also what people needed in the community, and just getting to sit down and talk to community members themselves through an interpreter. I think Duncan actually even conducted one of them in French. That was really cool. Just to hear about their experiences in the Congo or in the DRC and in the US, as well as their knowledge and experience with TB. It's really cool to see how many people actually have interactions with TB. I think coming from a country or from the large part of the US where TB is not really, we don't really know much about it as a developed country because it's not as prevalent here, but everyone that we talked to really had some sort of understanding of TB, or at least some sort of understanding maybe that could have been with HIV, but it was really just interesting to hear their perspectives, and I think really being able to intersect that with what I got from the research online and through different sources, I think it really supplemented my learning and really showed me how important it is to have a community voice in the clinic and how that can really impact care in the future. So I really felt that my work was very meaningful, and I was really honored to be a part of it. So I've always had an inkling. I myself am an immigrant, and I've always had an inkling of wanting to work with immigrants and refugees and people who are not from here, who find themselves in the US. And I know that just kind of seeking care is already very difficult in itself, and then compounded with a language barrier, compounded with being able to access certain services, or and the culture that's so different. I feel like being able to see that in IMC as well as in EthNmed really practiced to a really high standard is something that I really want to aspire to. But yeah, in the big picture, even possibly coming back here.